In Joburg, the closure of the Charlotte Maxeke hospital due to that major fire now means that there are many cancer patients who'd received treatment. They now have to wait for it to reopen or get their treatment elsewhere. Yesterday here on Newzroom Afrika, we spoke to a patient navigator from the hospital who said that treatments had not been compromised unduly and no one was in immediate danger of becoming dangerously ill. But she has admitted that the alternative, the Chris Hani Baragwanath Hospital, is under pressure.
Right now, for medical oncology, patients are being referred to Bara. When you get to Bara, it's the first floor on hematology department. I mean, the space is too small to accommodate all the patients at the moment, but the nurses and the doctors are doing their best. But to be honest, on a daily basis, they cannot afford to accommodate 150 patients. So all our patients have to call in. Sometimes they are not seen. They are being turned back home. It's just so overwhelming for the staff, but some of the patients are still getting their treatment, but it's not the same, to be honest.
Laura Lopez-Gonzalez is a health journalist. She's been reporting on this. Laura, good afternoon to you. I mean, this seems on the face of it to be quite a dire situation. Do we know how many patients are affected by this?
Right, so Charlotte Maxeke had about 5,000 cancer patients that it saw every month. About 300 of those were new patients. We know that the Gauteng Department of Health has admitted that nobody got treatment for at least 2 weeks. Cancer activists that we spoke to and many patients say that that's more like a month or 3 weeks. And many of those patients said that when they had started chemo originally, that was already a 3-month delay between, for instance, being diagnosed and actually starting their treatment. So we actually accompanied patients on the first day of treatment at Chris Hani Baragwanath, where some patients have been referred to. And it was quite chaotic. Many patients unsure if they would be turned away, if they would get treatment. Unsure whether their patient files have been transported over. We spoke to one family that was hoping that a doctor could treat their father using cell phone scans or pictures of his scans. And a lot of patients just really complaining that no one had contacted them after the fire. Calls to the hotline went unanswered. And so a lot of emotions running very high with patients who really felt like this sort of weeks-long delay was really impacting their treatment, and I think adding to a lot of anxiety for many.
So it's one thing for the Gauteng Health Department to not be able to use the hospital, but they can use the people who work there. I mean, you would like to think that if the hospital's closed, a doctor who treated a patient at Charlotte Maxeke will see the same patient, be the same doctor, at Chris Hani Baragwanath.
Right. So we do know that staff was redeployed. So some nurses and doctors were sent to Chris Hani Baragwanath and some were sent to, I think, Steve Biko. But patients have told us that, just because you added more healthcare workers doesn't mean you added more space. So we spoke to several patients who said that they received chemo in a sort of a hallway that, as your previous guest stated, it doesn't expand the sort of a capacity of the hospital directly to add extra staff. And certainly there was a lot of confusion among staff. So when we went with patients, nurses would speak about Bara staff or Bara patients and Charlotte Maxeke patients. And if you were neither of those patients, if you were a new patient, you were kind of in the back of the queue. We know that the Helen Joseph Breast Clinic has not been able to start a new patient on treatment for at least a month after the fire. So definitely some disruptions to care, and that certainly was a teary first day of treatment for many patients that we saw.
Some people must be really worried because a lot of these treatments for cancer in particular have to be at regular intervals. It's all specified. You're supposed to do things at a certain time and it's supposed to have a certain impact on whichever cancer that you have. If you miss that schedule, it's very difficult to know what happens, but it won't be good.
Right. So we spoke to one woman who has been waiting for radiation after she had surgery for an aggressive breast cancer. She was finally told that it would be a 3-year wait for her to receive radiation in Gauteng. She decided to move back to the Eastern Cape to seek care there. And she said that when she went to speak to that radiologist, she describes him as putting on a brave face, but he was like, he really should have been for radiation, more than 6 weeks ago.
I mean, that's incredible. I mean, do you think people are being placed in danger here? It would seem that the risk of that is very high.
Certainly a lot of the cancer activists we talked to felt that that was the case. One patient that we spoke to said that between the time of her, being diagnosed and even waiting the 3 months she did to get her first appointment, which was just days, it was slated for just days after the fire, that her tumor had almost doubled in size. So we know that I think, time is certainly of the essence for some cancer patients, is what activists are telling us.
Sure. Okay, and then the situation at the Charlotte Maxeke Hospital. So people can't go into the hospital, patients can't go into the hospital. For some, as I understand it, last I heard, the city of Joburg hadn't signed off on a compliance document. Okay, that's fine. But do we know if the equipment in that hospital was damaged? What I'm trying to get to is, this is cancer equipment. It doesn't get moved easily. But if that equipment was damaged, then we have a very serious problem.
Right. So this is one of the questions we put to the Gauteng Department of Health, and the answer was a little murky. So what they said was that the radiation clinic was damaged, and so was the specialized area that you need to prepare chemotherapy. They did say that no machines had been damaged, but they did say that 4 of their machines are offline, and it's unclear whether that's damage or they're offline because the clinic space is not open to patients. But they have said that because those 4 machines are offline, that the radiation waiting lists are going to grow. And prior to the fire, it was already taking some patients up to 18 months to receive appointments.
Wow. I mean, do you think the department's taking this seriously? Lives are on the line here. We have waiting lists that grow and grow and grow. People who will be absolutely desperate for treatment, they know how important this is. Do you think officials are taking this seriously? Do you think that they may feel that they've got to deal with COVID-19 in a third wave first?
You know, I think it's hard to say. The Gauteng Department of Health has said that they are in negotiations with a private provider who might be able to take some patients on. But, you know, this is the 3rd national cancer crisis we've had in the last 5 years. And I think, again, what you're seeing is this really centralization of cancer services makes them incredibly vulnerable to disruption. And the second that one hospital goes offline, it creates like these massive backlogs and waiting lists. And I think that you see this repeating over and over again, whether it's the last oncologist walking out of public sector care in KwaZulu-Natal several years ago, or, you know, the spate of broken machines that we had at Charlotte Maxeke just 5 years ago as well.
I mean, you speak to the KwaZulu-Natal example. I think there was another province, I think off the top of my head, it may have been Limpopo, that had a serious problem with the lack of oncologists in the public sector. I speak under correction when I say that. Cancer is difficult to cure and expensive. Is that why we keep having these problems in the public sector?
I think there just isn't enough public sector oncologists. The Cancer Alliance did just come out with a report saying that, you know, cancer medications remain exorbitantly costly, some because of patent issues. I spoke to one oncologist several years ago, and she had originally been an HIV clinician, and she had gone back to respecialize in oncology because for her, cancer treatment today in South Africa has a lot of parallels to sort of the darker days of HIV treatment in terms of, you know, not everyone gets treatment. The treatment is expensive. You can't find it everywhere. So I think that there's a lot of reason to be concerned about cancer care in South Africa in general.
Well, Laura Lopez-Gonzalez, I really appreciate the time, the health journalist. Thank you very much indeed. Can you imagine your family member, someone in your family just going through this in Joburg at the moment? Very, very difficult situation.